Welcome to News West 9's West Texas View with Johnny Lou Avery.
Welcome to the West Texas View. I'm Johnny Lou Avery, and our guest this morning is Dr. Joy Anderson. And she is going to be presenting a very, very interesting and unusual program about a very specialized gynecological care for young children. And this is a specialty that not many people, especially in our area, have. And so she's got a lot of answers that probably some of you have been looking for. She's part of the Texas Tech Physicians of the Permian Basin that works out of the clinic and out of the medical school, and is able to provide the experience and expertise to provide the most delicate and appropriate care for the younger patients. And everything that they do, and when they're treating these younger children, is focused on taking care of their special needs and then helping the families to cope with this. So I wanted to welcome you, Dr. Anderson, again to the program. You were here several months ago, and I want you to just talk a little bit about this special area and what it means.
Well, pediatric gynecology is not an officially trained subspecialty. We have some fellowships that are available, but a lot of us kind of grandfather in, a lot like urogynecology, where we have the training in our residency. But it's not technically something where you must obtain the training through a fellowship, and I have not. There are 6 fellowships in the United States, and I believe 1 in Canada, so they're very hard to obtain spots in there. A lot of what I did when I was in residency was at Children's Hospital of Wisconsin, so we would frequently get called by Children's Hospital of Wisconsin for little girls that had external problems, or girls that were in the hospital and started having vaginal bleeding abnormally, those sorts of things. And it was one of my favorite areas of residency that I really enjoyed. In private practice, I really built a practice out of adolescent gynecology too. My favorite population, to be really quietly honest with you, is the teenagers. I love them to death. They're the most challenging, and I feel like it's kind of a repaying karma on my own part for my own mother. You know, I was a pretty awful teenager, so it's repaying what I did to my family.
Supreme retribution.
Yeah, we won't go there. But I figure I'll get it back with my 5-year-old when she turns 13. You know.
And before we go any further, I think that's important to say is that you're a mother, and you're a mother of a daughter.
Yes.
So you have a special heart for treating these young girls.
Yes, absolutely. And I think my daughter picks up on that. When she was about 3, she got out of the bathtub and she was kind of messing with me, and she said, "Mommy, there's a problem with my bottom." And I totally took it, and okay, what's wrong, honey? You know, is there something wrong with you? Let's go lay down, I'll take a look. And she said, "Mommy, it's got a crack in it." And it was a joke, you know, and she suckered me in at the age of 3. I'm kind of proud of that. I'm kind of proud, but she's been a high maintenance kid the whole time. I love her to death because of that. I also have a son who's 3. So between a 5-year-old and a 3-year-old, we're a little bit busy, but she's wonderful. And she's actually pretty concerned about some of my patients sometimes. She asks me, "Did you go take care of a baby? And did you deliver a baby? Did you take care of a little girl that had problems with her bottom?" And it was really interesting to see her kind of develop into that. And she plays doctor sometimes and walks around in my coat. It's really cute.
So you're already putting her in training.
Yeah, there's something called dermatology, though, with better hours. You know, she might want to consider that.
Well, one of the things that you just mentioned, I want us to differentiate between forensic gynecology and what you're doing.
Yes, absolutely. I am not the place to send a little girl who's been sexually abused unless she's having a recurrent problem from that abuse. I do not testify in court unless somebody needs me to, but there's actually a SANE nurse, a sexual assault nurse examiner or sexual assault forensic examiner that's available in every emergency room that takes care of those sorts of situations. They're well trained at doing the forensic photography, obtaining the specimens, and testifying in court. That is absolutely not what I do. And in fact, I'm not even SANE certified. But I'd be happy to take care of a little girl that has pain or problems after that.
As a result
Absolutely.
of it.
Or if they need to consult for repair of a laceration, unfortunately, or something like that.
But so then talk about some of the types of problems that little girls need to come to you about.
A large part of what I see is premature puberty. So early puberty, especially as girls become a little bit more overweight, we tend to have puberty a little bit earlier, and it makes their families nervous. Or bad periods, which is called dysmenorrhea, or if they have irregular bleeding or start noticing any problems. Those are things that we see a lot of patients for. And strangely, I see a huge population around the age of 4 or 5 for vaginitis. And a lot of times it's potty training issues, and just really simple to fix with some antibiotics, or even just putting a tiny, tiny camera into the vagina and seeing what the problem is. But my main goal is to stay away from the operating room with little kids. That's just not a place to be doing things. And I really try very hard to not traumatize them in the clinic.
And you mentioned that sometimes the itching or the infections is caused by something as simple as a tiny little piece of toilet paper. That got stuck in their vagina. And so you can take care of that by washing it out.
Yes, we actually have a little teeny tiny tube that you can put in and kind of wash the fluid out, but it's not painful at all to the little girl. And of course, if she was uncomfortable, we'd be doing it with sedation in the hospital. But that's a pretty unusual thing. Usually kids actually take it a lot better than my 30-year-olds, to be honest with you.
And their mothers.
Yes, by far. Oh, gosh, no. I would not be able to bring my daughter in. It would be horrible. But for me, and I think taking care of my daughter in that way too, I think it would be easier for my daughter than it would be for me as a mom. But the majority of the things that I see are actually pretty easy to treat with some simple antibiotics, some simple hygiene issues. You'd be amazed how much bubble bath irritates little girls' bottoms. I mean, simple solutions for pretty scary problems for adults. But the kids are usually pretty laid back about it, and they know what happens and what we need to do.
Yeah, and but the thing that amazes me about our conversation today is that I'm a mother of a daughter, and I don't ever remember having any problems. So how would I? Was there something that she suffered and I didn't know about? I mean,
Probably
how would
not.
I know premature adolescent?
You would know.
Or,
and a lot of times it's just educating the family and telling them what's normal. You know, I've had patients come to me with what they thought was early puberty. When you really look back on it, it's generation after generation. Everybody goes through puberty at 11 or 12 or 10 in that family, and that's normal for them, or 15 or 16. And that's normal for that family. And so a lot of it's just education about what's to be expected. But there are also a lot of problems with heavy periods.
We're going to have to take a break, and that's a good place for us to start in just a minute. We'll be back in just a second.
Stay tuned. West Texas View will be right back.